Good afternoon and welcome to a special WHITT session. My name is Chelsea Whittington and I'm joined by someone whom I've admired for quite some time, my friend, my colleague, Dr. Danita Johnson-Hughes, Executive Director of Edgewater Health. Hi, Doc.
Hey, how are you, Chelsea?
I'm doing well. We're back again.
Yes, we are.
I had the opportunity to speak with you a few months ago this summer when we were all things vaccination. And May, as you well know, is your month. It's Mental Health Awareness Month. And when we think about mental health and more, but certainly we think about Edgewater Health, you and your team came up with an amazing series of community events every Thursday, the Hour of Power, where a different mental health topic was discussed. Tell me how that came about and the motivation behind that.
Okay. Well, as you're aware, May is Mental Health Month nationally. And so because we started out originally as a community mental health center, and so we focused primarily on behavioral health, mental health, and addictions, we thought this would be a very appropriate time for us to really focus in on mental health. And especially because all of the things that are going on today as it relates to COVID and kids returning back to school, and as you well know, all of those many mass shootings that we've had at the grocery store in Boulder, Colorado,
and we'll talk about that.
Yes, all of that stuff, that it's been really traumatic for a lot of people. And so our team actually came up prior to this with the idea of having a series of mental health topics that could benefit the community. Because a lot of the schools have been contacting us. And not only for their students who are having a hard time adjusting, coming back after COVID, but the families and the teachers. The teachers are having a really difficult time. And so we've got a team that's going out to a lot of the schools to assist the schools with just counseling and helping the teachers to develop coping skills and be able to cope with all the trauma that they're experiencing, because they're dealing with the kids who are having issues, but then they've got to go home and deal with their families and all as well. So it's really been problematic for them.
Absolutely, and you all have a front row seat to see all of the fallout from COVID. For the initial part of it, we looked at it from the medical standpoint. Oh, I got to get vaccinated. I don't want to be sick. I don't want to spread. Wear your mask. And those things are very important. But the fallout, doctor, afterwards has really changed just the way we do things all around and how we address things. And you mentioned the mass shootings. So I did want to touch on that briefly. Your organization, and I thought about educators. When I saw all of this, I thought about picking up the pieces. How do you move forward from something so tragic, not just the families, but a community as a whole? Gary is small in our minds, you know, a tight-knit community. So something like that, God forbid, happened. How do we move on? And I'm thinking the same thing in Texas, the mental health aspect of it. And they may not have the great resources like we do here.
Well, I'm thinking that as, you know, when tragedy strikes like that, it's like you have to bring all your forces to bear in order to be able to withstand that and to get through it. And community support is important, but also the professional resources. I don't know what they have in Uvalde, Texas, but one of the things we've been talking about here in Gary, one of our team members has been working with the Interfaith Association as well as the city of Gary to bring together a mobile crisis team. And
mobile.
So we're gonna, where the crisis occurs, we're gonna go, whether it's in a school, in a steel mill, or wherever, or just something that maybe the police officers encounter in the community. We're going to be able to go out and assist them in assessing and dealing with that situation. And I think that's really important.
That's critical.
And that's a national kind of a movement now. People are really looking at mobile crisis teams because, as you see, when you look at the news every day, there's always something going on. And so we need trained professionals who can go out and assist.
That is so critical. I'm so glad to hear that, because when I think about law enforcement, they arrive at the scene trying to assess and say, you know, somebody's in danger, let me help, but they may not necessarily be equipped to say, I shouldn't arrest this person, or I shouldn't handcuff this person. This may trigger something that, an outburst and things like that. So teaming up with the city and being on site to help in a situation of crisis, that's
and think
amazing.
about, too, when police officers go out, the ambivalence they might feel, too, dealing with the mental health crisis, when somebody's experiencing some kind of crisis, you know, they're just having a breakdown. And a lot of times the police officers are really ambivalent about dealing with that person. So calling in a mental health professional is helpful, because you know too all the liability that goes on. If something should happen, if the person should somehow get hurt, you know, they're going to be looking at the police officers. And so we want to be there to reduce the risk and just help manage the risk and get the person safely to some sort of treatment, whether it be in a hospital briefly or to some outpatient treatment or whatever it is. We want to be there to assist the community in doing that.
That is great news. Thank you for sharing that. Reflecting again on an hour of power.
Yes.
The topics were just so inclusive and engaging, from suicide and stress relieving and all these different areas. And the best part about it was a lot of the people presenting are people on your team. Talk about that.
Well, I have to say, we've got a deep bench.
Okay.
Shall I say that we have people who are, you know, many of the people have been actually in this field for a long time. If it's clinical social work or psychology, psychiatry, they've been in the field for a very long time, and so they've seen just about every kind of scenario you can name, and they've experienced it. So these are people who are in the trenches and who are very knowledgeable. And we've got new people who are coming out, you know, who are coming from, you know, various universities or just kind of new in the industry, and they're feeling their way, but they got their boots on the ground and they're learning. And so I just like to say that we have a very deep bench to pull from, and we're going to continue to grow that. So if anybody out there is looking for a career in this area, please contact us. We really need good people.
That is great. I was also afforded the opportunity. We've really been hanging out, huh?
Yes.
I got a chance to attend your ribbon cutting of the Cedar Lake office. Congratulations. For those who happen to miss that, can you talk about your new presence in Cedar Lake?
Okay. Well, for the past, I'd say 7 years or so, we have decided that, you know, although we got our feet wet and got started in the mental health industry, that you really have to be able to treat the whole person. Because people who come to you who may have a mental illness or an addictive issue, they may also have other physical medical issues, hypertension, diabetes. Those are things that are very, very prevalent in communities, especially communities of color like ours. And so we felt like we need to really get involved in treating the whole person. And so we actually acquired a couple of primary care clinics, one right here in the city of Gary and one that was in Griffith. Since that time, we added our one upstairs here in this main building at 1100 West 6th. But we thought, you know, after we did a market analysis, that we recognized that the community of Cedar Lake, they really didn't have any primary care services, especially as they pertain to women's health. And so we wanted to focus on women's health. We have 2 OB-GYNs who will be working out of there, and they'll be seeing women who are, you know, pregnant in their first trimester. And we have a family medicine practitioner who can see kids and adults who, you know, maybe not necessarily women. And so we want to focus on the community and bring something of value to the community. And so we really wanted to form a partnership with Cedar Lake. And I have to tell you, we were welcomed with
I was
open
going to ask
arms.
you, how did you maneuver that? You know, when you're going into just a new community, period, sometimes there's a challenge to say, well, what are you trying to do? But
they welcomed us. I think the Chamber of Commerce up there, the Cedar Lake Chamber of Commerce, was really happy to see us coming into the community. So we were really welcomed by them. And then when we had the ribbon cutting, we had a lot of the town officials who were there. And
Congressman Van was there.
And the congressman was wonderful because he has a passion for health centers. And so we wanted to make sure he was there and able to speak about that. And so we're just really happy because the people out there, they really welcomed us. They want us to be there. They want us to be successful. And so that's what we're doing. We're going to focus on that, and we're going to continue to grow. We got plans for some clinics in some other areas. You'll get more news about that soon.
And we'll have to break that breaking news if you're just tuning in. Hello. This is a CWIT session with Dr. Danita Johnson-Hughes, Executive Director of Edgewater Health. So, Dr. Hughes, you know I'm a PR chick.
Yes.
And I watch brands and I
Yes.
watch how people present themselves. And I will say, just from being a Gary resident
Yes.
and living in this neighborhood, I have watched Edgewater change and rebrand itself.
Yes.
I remember having to say, Edgewater Systems for Balanced Living.
Right.
A long, long name. Talk to me about your goals and your thinking, your line of thinking of doing that whole rebrand.
Well, as you said, Edgewater Systems for Balanced Living is a lot. It's a mouthful. And so as we began, before we, like I said, we were primarily behavioral health, so we were mental health, addictions, and doing a lot of the social health care. So we like to say that we do mental, physical, and social.
Mm-hmm.
So we were doing a lot of that, and we felt like, again, we wanted our focus and our branding to be around treating the whole person. And so we engaged a marketing company who helped us to really formulate or come up with a new brand that would encompass everything that we do. And so we landed on that name, Edgewater Health, new logo, the whole bit. So we've been promoting that for probably a couple of years now.
Yeah,
and
I see it.
And then, because we have changed our name a couple of times in the past, people were a little confused. Is it Edgewater Behavioral Health? Is it Edgewater System?
Yeah.
What is it? And so we said we're going to change all that. We are now one Edgewater Health, and that's the name we promote.
That's it, Edgewater Health, everybody. Now, summer's coming up, and as I was coming in today, I was handed a flyer that said Farmers Market.
Yes.
It's the Farmers Market for me. Okay, summertime. So talk a little bit about what we can look forward to next from Edgewater Health with the Farmers Market.
Well, I certainly can tell you that the last farmers markets that they had were absolutely wonderful. They invite a lot of vendors from the community, Gary and surrounding communities, who actually are involved in produce. So gardening, etc., fresh vegetables, fresh fruit, and then other vendors who bring other types of food, popcorn and stuff that they've made. And so we invite them in, and our whole aim is to focus on food insecurities in the city, because Gary is the food desert, so we don't really have full service grocery stores available. We have maybe one, and so we wanted to make sure that people were able to access food, even if it's just during that one farmers market session that we have. But the community takes advantage of it. People walk from their homes around here to come and take advantage of it.
So they're here in the parking lot?
They're here in the parking lot.
I'll be walking
over,
and I noticed on the flyer, and I'll be sure to post the information that the first one is coming up June 2nd. So that's next week. So we'll have to roll out more.
Absolutely.
And I just so enjoy coming to get the updates, because there are so many things that when I talk to you, I had no idea what's going on, and now we're able to share with others. And I want to say, I think the mobile crisis unit is my fave right now. It makes perfect sense. So for those who are watching who want more information about Edgewater Health, the various locations, the services, what do they need to do, Doc?
They need to call our number, 219-885-4264, and they can talk to either Tara Robertson, who is our marketing coordinator, or LaTanya Woodson, who is responsible for a lot of the community events, especially like the farmers market and the Hour of Power. She kind of helps coordinate those and put them together. Tara helps market them. So those 2 days, they can give you just about any information you want. And if they don't know the answers, I guarantee they'll find them.
They'll find them. I work with them on a regular basis, and I have to say, you do have a deep bench, Doc. I will say that. You have been tuned into a CWHITT session with Dr. Danita Johnson Hughes of Edgewater Health, located right here in the beautiful city of Gary. We've learned so much information about the resources available to not only Gary citizens, but all throughout Northwest Indiana. We invite you to follow them on Facebook, visit the website edgewaterhealth.org, or give them a call. These resources are for you, for your benefit, and for our families here. Doc, I want to thank you so much for joining, and I'm sure I'll be back, and if not before then, I will see you at the market on June 2nd.
Yes, ma'am.
Everybody have a great day.
Thank you. Bye-bye.